Welcome to today's podcast where we have pelvic health physiotherapist Beth Scott here to talk with us about perineal massage in preparation for childbirth. Hi, I'm Karen, the founder of Pregactive, and through this Pregactive podcast, I'm going to help you to feel empowered, informed, and confident through your pregnancy and motherhood journey as we talk all things health, mind, and fitness. Here we are. Welcome, Beth. Thank you so much for coming today. We have ample podcasts where we've had you on. And for those who don't know you or haven't heard those podcasts before, could you just give us a brief as to who you are and what you do?
Yeah, sure. Thanks for having me. I am a physiotherapist now. I've been working about a bit over 15 years. And my trajectory of my career has gone down the pelvic health path where I'm working with obstetricians and gynecologists. And I also work in maternity hospitals as well on the maternity ward. And a lot of my focus is around pregnancy care and postpartum care and recovery.
Amazing. And we are here now to talk about perineal massage. So, can you give us just a little bit of a rundown as to the purpose or even the benefits of perineal massage?
Yes, so the perineal massage has become very popularised, especially more recently, but it has been around for a very long time. We like to do perineal massage as a preparation, one of the things you can do for birth preparation for anyone who's preparing for a vaginal delivery. If you're having a planned Caesar, there's no point in doing any of this sort of work. However, if the plan is a vaginal birth, we do know that improves your birth outcomes and also helps with recovery in a few different ways. One of the main benefits for perineal massage is around the risk of perineal tears. We have a lot of robust research to show that women who perform perineal massage in the lead up to their births are far less likely to experience a severe tear of their perineum, including their third and fourth degree tears. As a bit of background, we grade tears 1, 2, 3, 4, and third and fourth degree tears interfere with the sphincters of the back passage. So, whilst the risk factor of having a tear to that extent is lower, we can reduce further by 67% the chance of having one of those more severe tears. To be clear, it won't, generally speaking, change your risk factor for the smaller degree tears, which is very important to be clear about. But I think a lot of women, when they hear that sort of stat, they really want to listen up and see what they can do to help their odds and things like that. The other thing we're also seeing is that when you perform perineal massage in your lead up, you're less likely to require an episiotomy. So that's a surgical incision that a healthcare professional in the delivery space will perform with your consent, of course, around trying to avoid a more severe tear. So they make the clinical decision and talk to you about the importance of preserving the perineum. So what we know with perineal massage is you're less likely to need that by 21%, which is, again, a fairly significant result. Which, of course, these things mean postpartum, your recovery is going to be a lot easier. So the significance of the recovery rates after that, not only immediately from a pain perspective, we know that perineal massage will reduce your perineal pain postpartum, but also longer term, what the implications are around having a more significant tear. Other things we're also seeing are there's a trend that you're less likely to have a prolonged second stage. Now, that's a very hard thing to quantify with regards to what would it have been otherwise. It's not a black and white number that someone could give. However, we do know there seems to be this relationship between women who have extended second stage, which is, of course, that pushing phase, which everyone wants to make sure that they're not pushing for a long time. It's a bit of a Goldilocks situation. We want you not too quick, but obviously not prolonged, again, which helps with postpartum recovery, longer term pressure in the area and what impacts that have on your tissues and how well you are able to support your pelvic floor recovery-wise as well. And I'm just thinking it's probably important to be clear on these stats. These are related to first vaginal deliveries, not necessarily for someone going for a second or third delivery. So anyone who's attempting their first vaginal delivery. But that would also incorporate women who've had a caesarean section potentially. The numbers might be slightly different because there may be a medical or anatomical reason why a Caesar happened in the first place for a first birth. But if you're going for a VBAC, I would still be talking to a lot of my clients about this as another adjunctive thing that you can do for helping with a more, I guess, comfortable recovery and things should a vaginal birth happen. So it's good to sort of outline that as well.
Yeah, amazing, definitely. And in terms of when to start, because it's not something you do in first trimester, when is a good time recommended to start this?
Yeah, look, it's not the earlier the better, as you said. There's a lot of the research tends to be around that 34 to 36 week mark. But this can be variable for women for a multitude of different reasons. So it should be always done after the okay from your leading healthcare professional, so your doctor, obstetrician, midwife team, who knows your clinical case. There may be reasons to delay that are individual to you. However, a lot of the research tends to indicate from about 34 to 36 weeks onwards.
Yeah, amazing. And actually doing the massage, can a woman do it herself? Does she need somebody else to do it?
Yes, you can definitely do yourself. It's one of those ones that a lot of women are a bit intimidated from a reach perspective, which is fair enough. A lot of women don't realise, and potentially when they are talking to friends or making assumptions or even looking at pictures or diagrams that they can access and handouts that they're given from their healthcare provider, a lot of it makes out that you need to be able to basically reach forwards over the belly, which is incredibly hard when you're in third trimester. And I think it's a bit unfair to make women assume that that's the only way. It's interesting because people forget you can actually reach from behind. So the direction that you're actually pulling, I've got a pelvis model here, and I know we'll go into this in a little bit more detail, but what we're actually talking about is the tissue here at the vaginal opening, but coming back from there, the direction is actually backwards. So you'll find your best reach option for most people is actually reaching from behind, not unlike going to the toilet and wiping. So it's that direction. So in fact, one of the positions a lot of women find the easiest to do this is actually sitting on a toilet if they're comfortable to, or a commode of some description, because they're in a supported position and they can reach more easily and it makes more sense to them. Or it might be that they're lying on a bed, lying on their side. But the purpose of it is to make sure that you're in a relaxed, basically passive position, and reaching forwards, you use your abdominal muscles to get there if you can reach there. So it's not even going to give the best outcome for the purpose of what you're doing in the first place. So if they're doing it on their own, definitely. But a partner can be involved as well. So if your partner is willing to help you with this, it's a really wonderful way that they can be involved too in your pregnancy care. I get a lot of women who are very keen, and partners who are very keen, to come along to an appointment where I can actually show and demonstrate a way in which is safe, comfortable, for them to be involved as well. And naturally, they're going to be able to reach a lot easier. So talking about positioning and things like that, it's a lot easier for women to relax fully if they're not having to think about the actual pressures themselves. So look, it can be either way. Some partners just, that's not for them, and for some women they wouldn't really want that either, and it's really comes down to the individual and the couple themselves. I even get some women who are uncomfortable to do it themselves or their partner, but they're really keen to still try their best with the perineal massage. And as physiotherapists, more and more we're starting to see women who are happy to come and actually do some of the perineal techniques in the clinic as well as part of their physio care. Obviously, it comes down to patient preference, basically, at the end of the day. So a few different options. But if it's feeling awkward in any way, there's probably a better way to do it, I guess, is probably the best thing to reflect on.
And that's a really good option because, say, she then, after even just one session with a physiotherapist, gets the feeling of what it should feel like.
Yes.
So that then if she does try it herself or get her partner to do it, then she's got that understanding and she can give that feedback.
Absolutely.
As to, no, actually that doesn't feel as good. And you can always do another session or a couple to really get the idea. Or like you're saying, if the partner's going to be involved, bring them in and do it that way, because there's so much unknown in pregnancy, and particularly, I mean, there is so much unknown in pregnancy, but in the lead up to childbirth, the unknown is just out of control. And that feeling of having confidence in something is just one tick of, okay, I'm feeling good with this.
Yeah.
And if they can do that, that's so amazing.
I'll to add in there, it's about demystifying it a little bit too. It's really popular for a lot of women to have a practice go with potentially a therapist to get the sense of the feel and the pressure and the location and all those sorts of things, but also to tailor it for them, because there may be very different aspects of it that are more important to focus on for someone versus somebody else, which might look a lot different. So I find how I teach it is really variable between people, purely based on how they're presenting from assessments earlier, and also transiently how they're feeling on the day, and talking about that. But definitely it's the demystification, because if you're reading about this, hearing a podcast about this, it's like, okay, how do I apply it to myself? And I'm feeling a bit lost. There's help available should you want to access that. Yeah.
And when we're talking about like oils or lubricants, what do you need to
You should definitely use a lubricant. Some women feel they can get away with their natural vaginal secretions, which is fine. That's really dependent on your comfort levels. The research is based on using a very mild lubricant of some description, because we're trying to reduce friction on that area. You can appreciate it's a very sensitive area, and the tissue there can be quite responsive to anything that might irritate. So the first and foremost thing I always say to people is, whatever you use, just make sure you're not allergic to it. So always do a patch test. But a lot of the research is based on having a lubricant that is the actual ingredient they prefer to have is sweet almond oil within it of some description. And having said that, some women might choose to use something like coconut oil or olive oil as well. So sometimes you've actually got what you need at home already. There are some specific perineal massage oils on the market as well, but just look at their ingredient list and have a bit of an understanding about what it is, because it's not more ingredients the better. Often it's keeping it quite simple that's critical, and you're less likely to be in a situation where you might react. So that patch test is actually pretty important. You can appreciate why.
I was literally just about to ask you, can you use coconut oil?
Yes. Yeah, I've seen people use it. Some people don't like the consistency. It's personal preference, really, at the end of the day, because we're trying to create a result where you're able to relax well And if whatever you're using doesn't feel right, and that goes for even the temperature. So I would always be suggesting to make sure that you're using like a warmed solution, or at least having warm hands before you start. It seems, to make sense really, to make it as comfortable as possible. So, but yeah, do look at what you've got at home as well.
Yeah, warm, not hot.
Yes, very much so. Yes, that, body temperature, I think, is probably the way to do it. Yeah.
So if a woman doesn't do perineal massage, what, like, I feel like there's some guilt, or people feel pressured to do it.
Yes, you can still give birth without perineal massage. It's only really become more popularized recently. So if I feel like, or you may feel like, it's talked about a lot more, which I think is good, because women are educated about the options and making sure that they're aware of what is potentially possible for them to benefit from. But women have been giving birth for hundreds of years, so it's not something that if you don't do it, it's not going to work. Don't ever pressure yourself to think that. Or there may even be a medical reason that you can't do it. And I can go to a few reasons around that. Reasons you wouldn't be doing this is because someone's told you not to, or you're not comfortable. But medical reasons why would be things like you've had some vaginal bleeding, you have an infection, like a thrush or a UTI or something like that. There's reasons not to do this at particular stages in your pregnancy for a reason. So at any point, if you're not able to, or you're not comfortable to, just remember it's an adjunctive treatment. It's an adjunctive approach. It shouldn't be the be all and end all of birth preparation for you, and there are other things that you can do as well. It just so happens that it's one that a lot of women can potentially utilize and do in the comfort of their own home. So accessibility might be greater than other things as well. So don't ever feel that it's mandatory in any sense. Even if you start and decide it's not for you, that's fine as well. So that's important to highlight.
So what are some basics of perineal massage?
Sure. When we're talking about perineal massage, and I should probably preface this with, it's making sure that you've got clearance to do this from your healthcare professional. We're talking about applying pressure to the perineum at the entrance of the vagina. So we're talking about the tissue here between the vaginal opening and the back passage. And it's not about trying to pull and stretch and cause discomfort and try and make this area get as long and as open as possible. It's about introducing pressure to the area that otherwise hasn't had that before, and getting used to the rhythm of that to assist in your delivery. So when we perform perineal massage, I often tell people literally to start with just gentle pressure to desensitize anything that might give you a bit of a discomfort, or any sort of burning, or anything that's worrying you. Don't go straight into stretching, okay? So we want to almost get the brain to accommodate and not react, because the whole point is to keep these pelvic floor muscles relaxed as we do it. We're also applying pressure almost like on the back side of the vaginal opening, as opposed to the external. Yes, we're talking about tissues here and helping them in terms of their recovery and how they perform in a vaginal delivery, but we aren't applying pressure here, nor are we trying to put our finger in and pull out. That's often what some people get confused by. The evidence is more around pressure in and then pulling down, okay? And it's incremental. So when we're doing this, usually I'm suggesting make sure you're not rushing in. I would always do a bit of like a warm shower or a bath or some stretches or something to get you in that frame of mind where you're going to be more relaxed. And then once you're, that could take you 10 minutes, an hour. If you want to do a yoga session first, it's a really lovely introduction to this. You don't want to be thinking about what's on my to-do list, and you want to be mindful and be engaged in what your body is telling you. And when you're actually starting, once you're past any sort of sensitivity to the pressure, the warmth of the oil that you're using is matching you, so there's nothing feeling off, that's when you can start to apply your pressure. And a lot of people want to go straight to, doing the massage. As a physio, I look at it, and if I'm going to be a purist, it's not massage per se. I would call it more pressure. So it's particularly in that lower arc, or if we talk about the vagina as a clock face, and we've got 12 o'clock at the top, 6 o'clock at the bottom, 3 and 9. We're talking about basically from about 3:30 through till about 8:30, 9 o'clock. Anything there is where you want to approach your pressure. There's no further evidence around applying pressure higher than that, so don't waste your time there from what we know currently with research. But it's about applying pressure and stretch and pull, and can you keep your pelvic floor relaxed at the same time? If you skip that step and you have any sort of reflexive pelvic floor co-contraction, so basically in response to a pressure or a sensation in that area that might make your pelvic floor muscles want to tense up, you're missing the full benefit. We want to keep those relaxed, and only when you do that should you really start the movements of potentially a glide, which is where the lubricant becomes the most important. But in a nutshell, that's the general progression of what we do is massage itself.
Fingers wise, you were demonstrating with the pointer finger.
Yep.
Is that the finger that you normally recommend?
I purely do that because that's how I perform it. Some people recommend 2 fingers if you're feeling you need a little bit more support. It comes down to your, dexterity and your strength and endurance in your hands or your partner's hands. It doesn't matter too much what you're doing. Sometimes people, when they really want to take it to an extreme, which is down the track when you're feeling confident with these pressures, you can actually use 2 from different hands to perform an actual stretch. But it's not something, you don't have to get to that to get the benefit on what we're talking about, just to be clear. It's all in your response. So if you're happy with just 1 finger at the entrance and performing these stretches, wonderful. It's you're working with what your body is letting you and what you're feeling comfortable with, and can you keep those muscles relaxed as you're doing it. The other thing to mention as well is we're talking about both. There's a couple of layers here. The superficial part, or the more external part that you can see from the outside, putting pressure through there. But whilst we don't have a direct link, we are, as physiotherapists, noticing a trend if you also apply this to the deeper pelvic floor layer. So outside of the superficial layer, can you take your pressure a little bit deeper and actually perform those stretches on the deeper pelvic floor layer too, as another alternative to, or addition to, your perineal massage as well.
Yeah. And without looking stupid, the feeling like when you do this.
Yeah. I think that's a fair call to make. And I talk to people about levels of discomfort that are appropriate. Because some people are just, competitive in nature and just want to crack on with it. I would always work within what your limits are, but the feeling of a stretched lip when you do that with your own fingers, most people would say it's not too dissimilar to that, but I would never take it further than that. It's not supposed to be painful, or definitely not bothering you any discomfort after you stop. If that's happening, there's something else going on that you're probably taking things a bit too far. I'll just reevaluate how you're actually doing your technique, which is, again, why a lot of people come into the clinic, because they're trying to get a sense of the pressure and how it applies to them. But I think that's a fair kind of comparison to have. And I know a lot of people talk about that pressure on the lip. It's almost like this burny feeling for some people. But I would never take it beyond that point.
Yeah. And talking about that burny feeling. So when you're crowning, so for those who you haven't had a vaginal birth yet, you go through this crowning process, and that's when Beth was talking about not necessarily going too quick in that part. That same burning feeling, what do they say, ring of fire?
Yes.
That it's about also having a level of endurance through that discomfort, but not trying to push out of it, but also trying to let your body relax during it.
Yeah. For lack of a better word, I was talking about this with somebody yesterday. I think the word surrender to that awareness is probably a way to approach that. But oftentimes at that point, you may have this overwhelming feeling to push really, really hard, and it's not necessarily beneficial to do that in one hit. And so practicing the perineal massage, whilst we have our theories on how it works, my suspicion a component of it is introducing you to this discomfort and being able to see how your body responds. And so it's not just going into birth without, like, you know, otherwise cold, so to speak. It's a really lovely it's a approachable and gentle way to kind of introduce you to that kind of sensation, not trying to replicate birth at all. Like, let's be honest, it's not supposed to be. And if it's anything, if you're pushing to your pressure that would replicate birth, it would not be appropriate for the lead up. It's just giving that sort of, I guess, practice in introduction to it that I think has the most benefit, as opposed to stretching to make the tissues stay open. Like, that's not the point necessarily behind it. And this sort of leads into the notion of how frequently you do it, because if that was the case, it would be the more the better. And we know from the research that's not the case. For the majority of people, it's actually 2 or 3 times a week. And sure, you can do other things. You can do stretches, you can do exercise, you can do breathing techniques. That's fine. But the actual hands-on perineal massage side of things is actually not potentially as much as what a lot of people think. And that's also important to know, because if your partner's helping you and they're not around as much, it doesn't mean that it's going to be less effective. So it's, just to make that point. So now there's some circumstances where we would do this more, because there may be some sensitivity issues, there may be some more reflexive muscle contraction that we're working on in a holistic sense beyond just perineal massage as well. But yeah, look, it's one of those ones where we want to make sure that we're doing what is required, but don't go overboard with it as well. Yeah.
So in quick summary, we're talking from 34 to 36 weeks to start, talking 2 to 3 times a week, using some sort of lubricant or something that at a good, nice body temperature that helps you. And really an important step is relax first.
Yes, absolutely.
Let your body be in a relaxed position, and then when you're actually doing it, do it in a position that helps you, going from the behind rather than trying to reach forward and go from the front. Sitting on the toilet might be a good option with your partner. If they can assist you, great. So not letting this be too overwhelming. And if you're not yet 34 weeks, go and speak to a women's health physiotherapist or pelvic health physiotherapist that can help you in getting your head around it as well. Like, it's never too early to talk about it or ask about it, and get the understanding of the anatomy, because sometimes it's hard to see and what's going on.
Absolutely. And look, I definitely see a lot of women around about that sort of 20, 21 week mark after they've had their major scan. And I'm already talking to them because they come in with, they're my favourite appointments to do. They come in with this real, okay, what can I do proactively to help with the rest of my pregnancy, my birth and my recovery? And this is one component. And whilst we're not starting it then, we're starting the skills that you may need to help perform that better with pelvic floor relaxation, with understanding around what my muscle function is like. And this plays into a change of course at the end, potentially from working on any strength or endurance deficits that they may have that we assess earlier on. And then they've already got that understanding of muscle movement, and then they apply it with the perineal massage, which I think is really important. So we do discuss it early on if people are asking questions and I'm sort of presenting the things available. But really it's the third trimester where we really get into it more.
Yeah, and without tangenting here too much from perineal massage, but it's not like you can do absolutely no other preparation for your body and then from 34 weeks do perineal massage twice a week and then you're 100% set up. Doing things like prenatal yoga, doing your mindfulness, your meditations, slowing down, ensuring, you don't have an overactive pelvic floor, that you are actually helping with that relaxation. And you got an optimal functioning body. That is where you're going to fully prep your entire body and your mind.
Absolutely. It's just a part of it. It's an adjunctive approach that is part of the bigger picture of all the different things that you can do to prepare for birth. Absolutely.
Amazing. Thank you so much for your time and all your knowledge. All these tips, I'm sure, are welcomed by the pregnant women watching this. Thank you, Beth.
No worries.
How incredible is Beth? Just so much knowledge, so much information there. I hope that you got a lot out of that. And this is just one of the many resources that we have in terms of pregnancy and birth preparation. For more just like this, head over to pregactive.com.